All right, everybody, welcome in. We're diving deep today. Going to be talking multiple sclerosis and orthotics. Super interesting stuff, and I think you're going to find it pretty fascinating. I know I did when I was prepping.
Yeah, it's definitely an area where there's always something new happening.
Right. So much to uncover. So
Mhm.
we're looking at some excerpts from a text that's all about orthotic treatment for MS.
Uh-huh.
But before we get into the nitty-gritty there,
Yeah.
let's start with the basics. Like, for someone who's maybe just tuning in, maybe they haven't dealt with MS personally, what is it? What makes this such a tricky thing?
So MS, multiple sclerosis, it's a chronic disease, affects the central nervous system. So we're talking brain,
Yeah.
spinal cord, the whole shebang.
The command center.
Exactly, the command center. And usually it hits people when they're younger adults. And the weird thing is, it's like the body turns on itself. The immune system attacks this myelin sheath that's the protective coating around our nerves, you
Yep.
know?
It's like what, stripping the insulation off a wire?
Perfect analogy, exactly like that. So those signals, they get all messed up, and that's where all these crazy symptoms come from.
And those symptoms, they can be so varied, right? And I guess that's part of the challenge with figuring out what's actually going on.
Absolutely. We've got two main theories about what might cause it. One's that it's autoimmune, the body just goes haywire, attacks itself.
Friendly fire?
Yeah, basically. Then there's the idea of a slow-acting virus, like maybe you get infected years ago, and then, bam, it triggers this whole immune response out of nowhere.
Oh, wow. Sneaky little viruses, huh? So I'm guessing that makes it super tough to diagnose.
You got it. Early stages. Forget about it. Symptoms are so mild, easy to miss. You might get some tingling, a little vision blur, fatigue. Who doesn't feel that these days, right?
You just brush it off like, oh, I need more coffee.
Exactly. But it could be something more. And MS can mimic so many other conditions. It can take years, literally years, to get a solid diagnosis.
So frustrating, right?
Yeah.
I mean, if you're the one experiencing those symptoms, you just want answers.
For sure. And that's why listening to the patient is so important. Got to piece together all those little clues, the symptoms, their history. It's like detective work.
You're like a medical Sherlock Holmes.
Huh. Something like that. But for real, the earlier we can figure it out, the better we can manage it. And that's where orthotics come in. Big time.
All right, let's talk orthotics.
Yeah.
And I got to say, I went into this thinking it was all about foot drop. But clearly, I was wrong. There's way more to it.
Oh, yeah. Foot drop's just the tip of the iceberg. We use ankle foot orthoses, AFOs, for that a lot. That's when the dorsiflexors, the muscles that lift your foot, are weak.
Okay, yeah, makes sense.
But it's not limited to that, like medial lateral instability. That's where your ankles want to roll in or out. Risk of falling goes way up.
Yeah, not good.
Nope. AFOs can provide that extra stability, keep you upright. And then there's plantar flexor weakness. Those are the muscles that point your toes down, help you push off when you walk.
Wait, so even if your foot isn't dropping, AFOs can still help with that weakness. How does that work?
Well, think about it. If those muscles are weak, it's hard to push off. You might even buckle at the knee. A rigid AFO, it actually shifts the force you get back from the ground when you step, moves it forward a bit so your knee doesn't bend too early.
So it's like a support system for the whole leg, not just the foot.
Precisely. And that's why understanding the biomechanics is so crucial. We got to incorporate the body's natural movement.
Fascinating stuff.
Okay.
Okay, you mentioned rigid AFOs. I'm assuming there are other types. How do you decide which one's right for a specific patient?
Good question. Like I said, got to tailor it to the individual. So if it's a milder case of foot drop, what we call flaccid, where the muscles are basically just not firing, a lighter plastic AFO can do the trick. Just enough to clear the foot when you swing your leg.
Gotcha. But if it's more severe?
Then we step it up. Might go with a rigid AFO, carbon fiber's popular, more support, more control.
Makes sense. Now, what about spasticity? We talked about weakness. But sometimes muscles get really tight with MS, right?
Yeah, that's spasticity. Tough one, honestly. Severe cases. AFOs alone might not cut it. Those muscles are fighting back hard. Could be too much for the AFO to handle.
So what do you do then?
Depends. We might look at meds, Botox injections, things to relax those muscles first. Then maybe an AFO can come into play.
Makes sense. Got to tackle the root of the problem. Speaking of other problems, we got to talk ataxia. Balance issues, right?
Yeah.
The source material mentioned shoe modifications can help with that too.
Definitely. Ataxia can be really unsettling. Feels like the ground's always shifting under you, not safe at all. So we try to widen that base of support, give you more stability.
Okay, how do you do that?
Simple things can make a big difference, like adding flares to the soles of the shoes. They stick out to the side, basically widening your footprint.
So clever. Anything else you can do?
Buttresses are another option. Think of it like reinforcement, strategically placed to support a specific area or counteract a deformity.
And I read about rockered soles too. Those sound interesting.
Yeah, those are great. They've got a curved shape, helps smooth out your steps, makes that transition from heel to toe way easier, prevents knee buckling too.
I bet that feels like a relief for someone struggling with ataxia.
Absolutely. And remember, it's all about finding the right combination for each individual.
That's what I'm hearing. It's all about personalized solutions.
Exactly. And that's why finding a good orthotist, someone who really listens, is so important.
For sure. Can't just slap on any old brace and call it a day.
Nope. It's a collaborative process. Got to work together to get the best results.
Well said.
Mm.
You know, it makes me think, with all the technology out there, where do orthotics go from here? I mean, will we have, like, smart AFOs one day, things that adapt to your symptoms in real time?
Who knows, right? But it's not crazy to think about. Sensors, new materials, the possibilities are pretty exciting.
Lots to look forward to. All right, fantastic conversation. Thanks for taking the time to break all this down for us.
My pleasure. Happy to share what I know.
I bet our listeners learned a ton today. Lots to think about for sure. So, till next time, keep those brains curious, folks.